Hi, I'm Siobhan from Nibbles, and today we're going to talk about getting your female rabbit neutered. For the girls, this is known as a spay, where both the ovaries and the uterus is removed. And we see it all the time, people asking questions online, what do they need to do before, what do they expect afterwards, what's normal, what's not. So we're creating this walkthrough guide for you to help you feel calm, confident and prepared for getting your rabbits neutered. And to help us, we're going to be following Bridget here and her daughter Pixie as they are going in to be spayed this week. Spaying is one of the most important things you can do for your rabbit's health and well-being. Unspayed females have a very high risk of developing uterine cancer, with studies showing that up to 80% will be affected by the age of 5. It also helps prevent false pregnancies, it reduces hormonal aggression and territorial behaviour, and makes bonding much easier, helping to keep bonds stable and strong. Once spayed, rabbits generally become calmer, more relaxed, and far easier to litter train. It's a big step towards giving them a happy, healthy life. The first step in getting your rabbits neutered is choosing a vet, and it's really important you choose a vet with plenty of experience when it comes to treating rabbits. Never ever be afraid to ask questions. You can ask things like how many rabbits do they neuter each week? What medications will they be sending home with your rabbits? A good practice will be really happy to talk through their processes, and you can keep asking questions until you feel confident. It's really, really important to remember that unlike cats and dogs, rabbits should never be starved before surgery. And if this is something the practice is recommending, it's a big red flag. They're not confident with treating rabbits. If you are struggling to find a vet or you just literally don't know which vet to choose, the Rabbit Welfare Association and Fund have a great resource on their website. They hold a list across the UK covering rabbit savvy vets, so do check out their website if you need help. You can make things much easier for yourself and for your rabbits by preparing ahead. Step 1 is preparing a carrier. Line the bottom with a soft mat, add some tasty hay for them to nibble on during the journey and arrival at the practice. You'll also need to prepare a packed lunch. We pack some Pro Fiber pellets along with their normal pellets, a little dried forage, further fresh hay, and in the morning we'll also add some fresh herbs. Anything and everything your rabbit really loves to eat, and to help encourage them to tuck in after surgery is a great addition to their lunchbox. And don't forget to pack a water bottle and clip just in case it's needed. Next, set up their recovery cage, so this is ready and waiting for when your rabbits come home. You'll need a small space to help restrict movement for the first 12 hours or so after surgery. Here at Nibbles, I bring all post-op rabbits into my spare room with the central heating set on low. If your rabbits usually live outdoors, they'll need to be brought inside as the general anaesthetic affects their ability to regulate body temperature, so it's important to keep them warm and stable for the first night. Having them indoors also makes it easier to keep a close eye on their recovery through the night. Line the bottom of the cage with newspaper or a puppy pad and add a soft mat on top. Use a low-sided litter tray to make access easy and add plenty of tasty hay to help encourage natural foraging behaviour. Don't forget to add a water bowl, and to help your rabbits feel safe and secure, especially if they're in unfamiliar surroundings, add a blanket over half of the cage. If you have a camera, it's also a great idea to set it up to help monitor your rabbits without further disturbing them. Now we're all set for the big day. Our routine at Nibbles is to feed only hay in the mornings and pellets in the afternoon. However, for any buns going in for surgery, we always give them a scoop of Pro Fiber first thing, usually around an hour before leaving. This helps to ensure they arrive with a full tummy and gives their digestive tracts a little boost before the general anaesthetic. So when you arrive at the practice, you'll generally be greeted by a nurse who will take you through and go through the consent form. This is also a great time to ask any last-minute questions that you might have. Generally, the surgery only takes between 30 minutes to up to an hour, but your rabbits will be in the practice for most of the day. In most cases, the surgery will give you a ring once your rabbits are in recovery and starting to come round from the anaesthetic. When it's time to collect your rabbits, the nurse will discharge them and go through post-operative care with you. They'll also let you know what your rabbits have eaten since they came round from the general anaesthetic, and whether or not they have eaten alone or needed to be syringe fed. You'll also be sent home with some oral pain relief, some recovery sachets, and possibly some gut stimulant. They will also give you the dosage and when the next dose is due. A post-op check is usually booked within 2 to 3 days after surgery, just to make sure everything is healing as it should. In some cases, if rabbits have interfered with their wound while at the practice, they'll come home wearing a pet medical suit. This just helps protect the area from further interference once you get home. It's really important to remember that rabbits should never ever be sent home wearing a cone, as these prevent them from being able to reach behind. When you arrive home, take your rabbits straight into the recovery space and check their surgical sites before placing them into the cage. You don't want to see any bleeding or tearing from the site. Offer their favourite foods and leave them quiet for at least an hour to settle and relax a little. I rely heavily on our camera, which enables me to keep a close eye on their recovery without continually having to enter the room. I have left Bridget and Pixie undisturbed for an hour and have been closely monitoring them on the camera. They have both started to move around a little and begin to nibble at food during this time. One of the biggest contributing factors to rabbits not eating after surgery is stress, and we can inadvertently add more stress onto them. The best thing you can do when you get them home really is to leave them quiet for the first 2 to 3 hours. But when do you panic? When is the point you really need to start to worry that your rabbit hasn't yet eaten after surgery? Well, generally, I would say between 3 to 4 hours if you're seeing no interest in food and there's been no droppings. At this point, I would consider giving them around 5 mil of the recovery feed that you should have been sent home with from the vet. Leave that for about 1 to 2 hours and then check on them again. If your rabbit still hasn't eaten, I would recommend giving 5 mil of recovery every hour throughout the night. This can seem like a lot, but it really does help start their guts going again. If by the morning there has still been no interest in food and no droppings, give the vet a call as soon as they open and they'll be able to give you more help and guidance. We regularly neuter rabbits at Nibbles, both girls and boys, and very rarely have we ever had to intervene with any serious syringe feeding. So please don't worry too much. It's certainly something that isn't common, and your rabbit should recover just fine. The following morning, I checked both girls' surgical sites to ensure everything is okay. Bridget is happier to be handled and was happy to give you a peek at her surgical site too. As you can see, the area is closed, dry and looking good. Pixie's site looked much the same, so I'm happy with both girls at this stage. After checking their sites, it's time to give them their pain meds, and Bridget is a pro at taking her meds, and as you can see, she is happy to take it straight from the syringe. Pixie, on the other hand, is not going to take her meds voluntarily, so we need to catch her. Forcing a rabbit to take oral medication is a big worry for many rabbit guardians, but there is a quick and easy trick. Place the rabbit between your legs, putting your feet together to create a V, and place your weight on your heels, not on the rabbit. With the rabbit in this position, it is easy to hold their head with one hand and place the syringe in their mouth with the other, and slowly administer the meds. Although I've seen both rabbits eat overnight, I give them some more pro-fibre pellets just to check their appetite. Bridget tucks in immediately, but Pixie doesn't, and this could just be due to stress, as I have just handled her twice. So I nip into the garden and pick some fresh grass, which she eats immediately. I'm now 100% happy that both girls are ready to return to their normal enclosure. We will continue to feed a portion of pro-fibre pellets for the next 3 to 4 days post-surgery, just to help to boost their digestion. And today we give them additional fresh herbs just to ensure their tummies are nice and full once again. We continue to check surgical sites daily to ensure they are healing as they should. If you have any concerns, no matter how small, contact your vet immediately for further help and advice. 5 days post-surgery and both girls are looking great, with surgical sites having closed perfectly with a little scab over the wound. This is exactly what you want to see. Right. As you can see, we've done this entire process keeping both Bridget and Pixie together. As mother and daughter, they arrived in our care together and we have kept them together ever since. If you do have 2 rabbits that are both in need of being neutered and they are bonded, we do recommend getting them booked in on the same day. It's much less stressful for them overall and much easier on their recovery. I really hope you found this video helpful and it's made you feel calm, confident and prepared for getting your rabbit spayed. It really is such an important part of rabbit welfare, so hopefully now you'll feel confident in getting that appointment booked. As you can see, Bridget and Pixie have come through the op just fine and it's been a real milestone to get Bridget here, who arrived in our care really, really unwell a few months ago. All of our work here at Nibbles is funded through public donations, which enables us to help rabbits like Bridget and Pixie and produce these videos to help you. So we'd be really, really grateful if you'd consider making a donation, or even better, sign up to be one of our superheroes through a monthly pledge. All information can be found on our website. Thank you for watching, and again, I hope you found this video helpful. Goodbye from me, Siobhan, and from Bridget and Pixie, who's now hiding under the stool.